Primary health care reflects and evolves from the economic conditions and socio-cultural and political characteristics of a community. Any improvements in health must also address these issues, in addition to existing health practices and beliefs. Therefore, the mechanisms for change are individuals from the community who are familiar with and understand existing issues, practices, and beliefs. Only empowered people can empower others, which is the goal of community-based primary health care. Our goal is ultimately about communities having control over their own lives. Therefore, at the core of our model is the selection, training, and continued relationship with a village health worker. When new village is asked to work with CRHP, their first task is to nominate a village health worker. Time and time again, experience has shown that development of the rural poor happens through empowering women. So CRHP advises the villagers to select a woman with roots in the local community who represents its poor and marginalized members. While it is important that she have a true desire to learn and a strong inner motivation to care for the health of her community, CRHP has found that her literacy level is indeed irrelevant. After explaining the important role of the village health worker as the community spokesperson and representative, a village meeting is held with people representing all castes, religions, and socioeconomic groups. After a nominated woman accepts her new role, she is invited to Jamkhed to begin an intensive 3-week training at CRHP. During training, village health workers from all castes, religions, and socioeconomic backgrounds gather to learn about and break oppressive cultural practices, to learn about medicine and basic care of their community, and to build practical skills and development. Prior to CRHP involvement, the vast majority of deaths were caused by completely preventable diseases. Studies showed that nearly 80% of all health problems can be prevented or managed by the people themselves. Thus, CRHP focused these training sessions on demystifying medicine to teach women important skills to identify and treat malnutrition, water-borne diseases, and diarrhea and infections. They also learn how to address harmful superstitious beliefs about illnesses. They are trained in detail about how to conduct a safe delivery, how to identify complicated pregnancies, and how to care for pregnant women and infants. Later, they are trained how to identify, treat, and care for patients with chronic diseases such as leprosy, tuberculosis, and HIV/AIDS. However, to get people to act requires more than providing them with information. It is developing self-esteem, self-confidence, and the realization that they have the power within themselves to improve their own health and that of their family and community. Therefore, training sessions also focus on personal development. With the help of trainers, they begin to break the barriers of caste and gender oppression within themselves and develop a spirit of camaraderie with their fellow village health workers. As a result, their self-image greatly improves as they see themselves as equals, both to each other and to men. Tasting the freedom of empowerment, women gain great self-confidence and courage to spread the personal transformations they have experienced to the other women of their villages. To help with this, they are also taught practical skills in how to begin and run community-based organizations. After 3 full weeks, health workers return to their villages to begin establishing the rapport and trust of their community. While their primary focus is on caring for the poorer and lower caste members of their village, they are available for anyone who needs their services. Eventually, as complete volunteers, village health workers become responsible for not only diagnosing and treating diseases in which they are knowledgeable, but also for family planning and working with other community organizations to conduct health education throughout the village.
When I first returned from the training session and began to use what I had learned, few people trusted me. They couldn't believe that a woman who used to only weed gardens now knew about healthcare. However, after the villagers saw me successfully demonstrate what I had learned on my own relatives, they slowly allowed me to treat them. For example, when I saw a child with a fever, I would immediately treat them with a cold sponge and fluids, and they quickly recovered. Or if a woman was in labor, I was able to deliver the baby safely and skillfully. If I found a difficult pregnancy, I would know to refer the mother to the hospital for secondary care. I would bring several village women with me to the hospital to see what was happening and to teach them as well. Gradually, the villagers saw that the people I treated were healthy, even though they didn't go to the hospital, and they accepted me as a reputable health worker.
As a valuable member of the health team and CRHP's main contact in the villages, village health workers return to Jamkhed every Tuesday for continuous training to discuss problems they have been having, to learn about new diseases, and to report all the health and development activities in their villages. There is no set syllabus for these trainings, and each session is a form of participatory learning, tailored to the problems and interests of the village health workers. This process is one that empowers these women, who in turn will empower their community, which is the intended outcome. At CRHP, village health workers are respected and valued for their unique skills as part of a greater health team. They are seen as equals to doctors, nurses, and to all staff. Indeed, their work has paid off. They have decreased the infant mortality rate from 176 per 1,000 live births to just 24. They have virtually eliminated tuberculosis, leprosy, malnutrition, and death by preventable diseases. They have ensured complete immunization of 99% of children, assisted 68% of women to undergo both permanent and temporary family planning, have eliminated harmful superstitions, and have helped establish highly successful community organizations.